Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. NEET PG Supreme Court seeks response from Centre on MCC modified OBC reservation criteria. Seeking to know the Union Health Ministry's stand on a plea challenging the Medical Counselling Committee's decision of modifying the OBC reservation criteria for the institutional preference seats in central institutes, the Supreme Court has directed the Additional Solicitor General to file an affidavit in this regard within 4 weeks. The candidates contended that the rules of the game were changed after the counselling for PG courses started, and especially before the candidates were asked to fill their choices on 13th of January. After taking note of the matter, the top court bench comprising of Justice D.Y. Chandrachud and Bella M. Trivedi directed the ASG Ms. Aishwarya Bhatti to file a response and noted that Ms. Bhatti file a return. This is an important issue. The notice in question was published by MCC on 10th of January, and the committee had modified the OBC reservation for admission to PG courses and restricted the reservation to the candidates belonging to Central OBC list. The matter has been listed for further hearing on 19th of July 2022. Medical students of China varsities seek practicals in India. Demanding the government to accommodate them in Indian medical colleges for practicals, 300-odd Indian medical students who had enrolled in Chinese universities protested at Delhi's Jantar Mantar Road on Sunday. The students gathered under the banner of Indian Students in China and Foreign Medical Graduates Parent Association and conducted Chalo Delhi, a pan-India mass gathering from 10 a.m. to 4 p.m. It is to be noted that the Supreme Court, in a recent verdict, directed the National Medical Commission to frame a scheme within 2 months to allow these students to undergo clinical training in India at local medical colleges. The protest was attended by the students and parents from Manipur, Tamil Nadu, Karnataka, Tripura, Kerala, Andhra Pradesh, and Jammu and Kashmir. Heal by India initiative, Centre developing online repository of healthcare professionals. To project India as a global source in the health sector, the Centre is developing an online repository of healthcare professionals, including doctors, nurses, and pharmacists, and that also mentions that the country where they wish to render their services. The portal, being developed by the National Health Authority under the Ayushman Bharat Digital Mission as part of the government's Heal by India initiative, is likely to be launched on 15th of August. Vitamin D pill you pop may not play a role in preventing diabetes, according to a study. Vitamin D supplement does not have a role to play in preventing diabetes, especially the type 2 diabetes in high-risk adults, according to a study published in the British Medical Journal. In a linked editorial, researchers say until further data are available from high-quality randomized trials, healthcare professionals should continue to discuss with patients the musculoskeletal health benefits of vitamin D and support them to achieve and maintain lifestyle changes that, although challenging to sustain, are known to decrease the development of type 2 diabetes. Some studies have shown that vitamin D deficiency is associated with an increased risk of diabetes, but trials using its supplements to prevent type 2 diabetes show inconsistent results. The findings published in BMG are based on 1,256 Japanese adults with impaired glucose tolerance recruited from 3 hospitals in Japan between June 2013 and August 2019. Their average age was 61 years and 46% were women and 59% had a family history of type 2 diabetes. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.